The Honourable Member for Edmonton-Ellerslie.
Thank you, Mr. Speaker. It's my pleasure to introduce to you and through you to all members of the Assembly, guests here today from the Canadian Obesity Network. Dr. Arya M. Sharma, Scientific Director, Dr. Jimena Ramos-Salas, Managing Director, Marty Enickson, Chair of the Public Engagement Committee, and Alex Schwarmer, also on the Public Engagement Committee. The Canadian Obesity Network is Canada's leading obesity organization and is made up of healthcare professionals, researchers, policymakers, and people with an interest in obesity. I want to thank them for all of their work, and to now please rise and receive the traditional warm welcome of this Assembly.
Welcome.
Member statements.
The Honourable Member for Edmonton-Ellerslie.
Thank you, Mr. Speaker. Many people who have known me have recognized that I've lost a considerable amount of weight over the last year. Legislative security staff joke with me, actually, that I'm one of very few MLAs to actually have lost weight being an MLA. we have a good laugh about it. However, Mr. Speaker, obesity in Alberta is not a laughing matter. There are approximately 648,500 adults living with obesity in this province. Individuals with obesity experience weight bias and discrimination in a number of ways. This discrimination impacts the health and well-being of individuals with obesity beyond any physical obesity-related impairments that they may have. 63% of children with obesity face higher risk of being bullied. 54% of adults with obesity report being stigmatized in their workplace, and 64% of adults with obesity report experiencing weight bias from healthcare professionals themselves. The World Health Organization recognized obesity as a disease when it was established in 1948. However, the same cannot be said of all different orders of government in Canada. For example, anti-obesity medications are not covered by provincial public drug benefit programs or any of the federal public drug benefit programs. The number of bariatric surgeries in Alberta has continued to rise steadily in the last 6 years. However, it's still the case that not everyone who is eligible for this surgery is able to access it. Mr. Speaker, we can all agree that we need to focus on addressing this very important issue, and for that reason I invited staff and community members of the Canadian Obesity Network here today to the Legislature. I'm counting on all members of this Assembly to become informed on this issue and to meet with their constituents that have the experience of living with obesity. By working together, we can help the many Albertans who need help on this matter. Thank you.
The Honourable Member for Battle River Wainwright.